There's a moment in this case that sounds almost too ridiculous to be real. A licensed medical provider was ordering cancer genetic tests for Medicare patients. Expensive tests, serious tests, tests that are supposed to help determine whether someone may be genetically predisposed to certain cancers. But according to federal prosecutors, some of these orders happened after phone calls that lasted less than 30 seconds. And it gets worse. The evidence showed that ovarian and cervical cancer tests were ordered for male patients, not once as a clerical mistake in some giant system. This was part of what prosecutors described as a fraud scheme that caused more than $12 million in false and fraudulent claims to Medicare. And the person at the center of it was not some random fake doctor operating from a burner phone. She was a licensed nurse practitioner. Her name was Charmaine Lawson Baker, and according to the Department of Justice, she had even presented herself as an expert in Medicare rules, medical necessity, and patient-provider relationships. That is what makes this story so wild, because this was not just about someone misunderstanding the rules. This was about someone who allegedly knew the rules well enough to teach them, while violating the very standards those rules were built on. On June 17, 2026, the Department of Justice announced that Lawson Baker was sentenced to 87 months in prison. That is more than 7 years. She was also sentenced to 3 years of supervised release and ordered to pay more than $1.5 million in restitution. Now, to understand why this case matters, you have to understand the machine behind it. Medicare fraud is not usually dramatic in the way people expect. It is not always someone running out of a bank with a bag of cash. A lot of the time, it looks boring. Forms, billing codes, signatures, patient records, doctor orders, lab requests. But inside that boring paperwork is where the money moves. And in this case, prosecutors said the money moved through cancer genetic testing. These tests can be legitimate, they can be important, they can help patients and doctors make better decisions when there is a real medical reason. But the key phrase is real medical reason. Medical necessity is everything, because Medicare is not supposed to pay for a test just because someone found a patient's name and slapped a provider's signature on an order. There has to be actual care, actual review, actual patient evaluation, actual medical judgment. According to the DOJ, from October 2018 to October 2019, Lawson Baker worked as an independent contractor for a company that claimed to provide telehealth services. And her job, according to the evidence, involved signing hundreds of orders for cancer genetic tests. The prosecutors said these were not careful medical evaluations. They said many of the calls were brief. Some were typically less than 30 seconds. No physical exam, no meaningful patient-provider relationship, no real review of whether the test was necessary, just orders, signatures, and then bills. That is the fraud pattern right there. The patient becomes a billing opportunity, the provider becomes a rubber stamp, the lab gets paid, the middlemen get paid, and taxpayers are left holding the bag. The Department of Justice said Lawson Baker caused over $12.1 million in false and fraudulent claims to Medicare. The laboratories involved received over $1.5 million in reimbursements from Medicare for the unnecessary testing she ordered. And according to the DOJ, she accepted kickbacks and bribes from the telehealth company in exchange for signing those orders. That is the part people need to understand. In many healthcare fraud schemes, the fraud does not work unless someone with credentials gives it legitimacy. A signature changes everything. A provider number changes everything. A medical order changes everything. That piece of paper turns a sales operation into something that looks like healthcare. And that is why these schemes are so dangerous. Because from the outside, it can look official. The patient gets a call. The caller says this is covered by Medicare. They mention cancer screening. They mention genetic risk. They may already have personal information. The patient thinks, well, this sounds medical. This sounds preventive. This sounds like something my insurance might cover. And then behind the scenes, that patient's Medicare information becomes a billing ticket. That is the darker side of fraud. The victim is not always just the government. Sometimes the patient is used as the tool. Their name is used. Their identity is used. Their medical record can be polluted with tests they did not need, conditions they may not have, or results nobody ever properly reviewed. And in this case, the DOJ said Lawson Baker never reviewed the results of any of the tests she ordered. Think about that. These were cancer genetic tests. The results could show that someone had a variant connected to cancer risk. And prosecutors said she did not review them. So the test was not really about the patient. It was about the payout. There was also a recorded call introduced at trial that tells you exactly how the government viewed the intent. According to the DOJ, a telehealth company phone operator told Lawson Baker she would be rolling in money by signing the orders. Her response was, "Honey, I am not complaining." That line is brutal because it cuts through all the excuses. It makes the case feel less like confusion and more like a business model. Now, after a 3-day jury trial in July 2025, Lawson Baker was found guilty of 6 counts of healthcare fraud. And almost a year later, she got the sentence, 87 months. But this case is bigger than one person. The DOJ says its healthcare fraud strike force program has charged more than 6,200 defendants since 2007, and those defendants collectively billed federal healthcare programs and private insurers more than $45 billion. That number should stop people cold. $45 billion in alleged or charged billing connected to these enforcement actions. That is not a few bad actors. That is an industry of fraud. And what makes healthcare fraud so hard to fight is that it hides inside systems people trust. People trust nurses, they trust doctors, they trust Medicare, they trust anything that sounds like screening, prevention, testing, or treatment. Fraudsters know that, so they do not always sell greed. Sometimes they sell fear, cancer fear, aging fear, medical uncertainty. The fear that if you say no, you might be missing something important. That is why genetic testing scams became such a powerful fraud lane, because the pitch sounds responsible. Do you want to know your risk? Do you want to protect your family? Do you want a test that Medicare may cover? It sounds helpful, but when the test is medically unnecessary, when the provider is not really evaluating the patient, and when the order exists mainly to unlock reimbursement, it stops being healthcare. It becomes extraction. And this is where the public needs to pay attention, because fraud has evolved. It is not just the obvious scam email with bad grammar anymore. It is credentialed, it is documented, it is dressed up in compliance language, it borrows the symbols of legitimacy, and sometimes it even comes from people who know exactly how the rules are supposed to work. That is the lesson here. A healthcare credential is not a blank check, a Medicare covered service is not automatically legitimate, and a medical test is not automatically necessary just because someone with letters after their name signed the order. So what should people watch for? First, be cautious when someone contacts you out of nowhere offering medical testing, especially if they're pushing urgency or saying Medicare will cover it. Second, ask whether your own doctor ordered the test. Not a random telehealth provider you have never met. Not a call center, your actual doctor. Third, be careful with your Medicare number. Treat it like financial information, because in fraud cases, that is exactly what it becomes. And finally, remember this. The most dangerous scams are not always the ones that look fake. The most dangerous scams are the ones that look official enough to make you stop asking questions. In this case, prosecutors said cancer genetic tests became a money machine. Patients became billing opportunities, and a licensed provider became, in the government's words, a rubber stamp. Now she's going to prison. But the bigger warning is still sitting right in front of us. Fraud does not always break into the system. Sometimes it logs in with credentials.